Welcome my presentation. My theme is reversal autoimmune toxicity and the loss in the tumor response by interleukin 16 blockade. Introduction. Autoimmune disease and illness that occurs when the body T-cells are attacked by the immune system. The immune system is a complex organization within the body that is designed normally to seek and destroy invaders of the body, including infections and infections.
The human body is a haven for life, and much like a prosperous country, is prone to attack. Throughout your entire life, every minute of every day, your body is under invasion from the outside world. Bacteria, microbes, toxins, and parasites have their own specialized methods of attack. Thankfully, your body can defend itself with its own highly sophisticated army, the immune system. Like an army, the immune system is highly diversified, full of specialized warriors capable of countering an attack, however and wherever invasion occurs. On the front lines of the battle, your skin provides a stalwart barrier between outside invasion and the fragile, life-sustaining organs within. To fight off attackers, also known as antigens, that do enter the body, the immune system wields an immense arsenal of cells which work together to prevent disease. Dendritic cells capture antigens and present them to T cells. T cells are the most important immune cells. They can recognize disease-causing microorganisms and rally other immune cells to attack the invaders or kill the invaders themselves. B cells produce antibodies, substances that are designed to attack specific antigens. Phagocytes, like ravenous monsters working for the immune system, are large cells that eat antigens, capturing and destroying microbes and other foreign particles. A healthy immune system will keep the body free of sickness most of the time, recognizing harmful foreign invasion and using its legions of cells to attack sickness-causing antigens. But sometimes, the immune system stops working properly, and instead of attacking harmful intruding antigens, it mistakenly attacks the body's own cells. This friendly fire is called autoimmunity. In an autoimmune disorder, the immune system begins to manufacture T cells and antibodies directed against its own cells and tissues. As a result, healthy cells and tissues are destroyed, which leaves the person's body unable to perform important functions. Nobody is certain exactly why or how autoimmune disorders occur, but contributing factors include genetics and environmental conditions that can trigger the disorder. Some of the known environmental triggers include drugs, viruses, bacteria, foods, pollutants, hormones, and stress. There are hundreds of known autoimmune disorders that affect nearly every part of the body, but some of the most common are rheumatoid arthritis, lupus, Crohn's disease, psoriasis, multiple sclerosis, and vasculitis. Treatments for autoimmune disease include hormone replacement. In some autoimmune diseases, hormone-producing glands are destroyed, leaving the body without key parts of its messaging system. When this occurs, a doctor can prescribe replacement hormones. A common example of this is in the use of insulin in patients with type 1 diabetes or thyroid hormone replacement in Hashimoto's disease. Corticosteroids are used to control inflammation by suppressing the overactive immune system. The disadvantage of this treatment is that it can leave the body susceptible to outside harm because they suppress the whole immune system. NSAIDs, non-steroidal anti-inflammatory drugs, are used to ease pain and swelling. DMARDs, disease-modifying anti-rheumatic drugs, are used to suppress an overactive immune system and can reduce pain and swelling and prevent long-term damage to joints and organs. Biologics, often called immune response modifiers, are a class of drug which interpret the events that drive inflammation by targeting a specific attack rather than a whole body attack. Currently, scientists are experimenting with stem cell therapy treatments for autoimmune diseases. Such treatments involve reprogramming cells to replace damaged tissue, or replace a patient's immune system altogether by replacing bone marrow where immune cells are generated. Though millions suffer from autoimmune disorders, more new treatments and research are available to keep the body's defenses aimed towards its enemies rather than towards itself. Brought to you by the American Autoimmune Related Diseases Association, or AARDA.
Application in medicine. Patients with autoimmune disease frequently have unsolved antibodies circulating in the blood that target their own body. Designs. Patients with autoimmune disease have typically been excluded from immunotherapy clinical trials, although recent evidence suggests that the benefits of checkpoint therapy may outweigh the risk of autoimmune flare-up in carefully selected patients who have a high probability of response. Pros: Vitamin D plays an important role in the immune system battle against infection and the control inflammation. Immune cells have vitamin D receptors, and activated vitamin D is a very effective modulator of the immune function, reducing the inflammatory response and limiting autoimmune attacks.
When the body becomes its own enemy, our immune system stops foreign invaders from harming the body, and sometimes it mistakes the body as the enemy and causes harm instead. Our immune system is meant to protect our body from foreign invaders such as viruses and bacteria. But when someone suffers from an autoimmune disorder, his immune system mistakes the body as the enemy and starts attacking it. Autoimmune disorders can affect any part of the body, including the joints, skin, and internal organs such as the kidneys or the brain. There are over 80 types of autoimmune disorders, which include rheumatoid arthritis, spondyloarthritis, systemic lupus erythematosus or lupus, and systemic sclerosis. Rheumatoid arthritis, spondyloarthritis, and lupus are among the most common autoimmune disorders in Singapore. The conditions are thought to be caused by a combination of genes and environmental factors such as infections and viral attacks. Drugs or chemicals can also trigger such diseases in some people. The effects of autoimmune diseases vary. For some patients, the disease causes the autoimmune system to attack their kidneys or brain, while in other people, it could be their blood or lungs that are affected. The symptoms vary too depending on the type of autoimmune disorder. A disease may manifest itself in one patient as weight loss or fever, while another patient may suffer a rash or an inflammation of the skin. As these symptoms may be due to other diseases, being able to recognize these patterns that typically show up in autoimmune disorders is key to correct diagnosis. It is also important to examine the patient and his medical history closely. It's very much like detective work supported by investigation. Autoimmune disorders can sometimes be life-threatening. For example, lupus, an autoimmune disease characterized by acute inflammation of various tissues, can become dangerous when it affects the kidneys or cause bleeding in the lungs. Autoimmune disorders are treated with medications to suppress a patient's overactive immune system. These medications must be used with care as they can weaken the immune system and so increase the risk of infections. There is room for optimism. The 10-year survival rate for lupus patients today, for example, exceeds 90%. However, new and better treatments are urgently needed. The sooner an autoimmune disorder is detected and brought to the attention of doctors, the earlier it can be treated and the better we can prevent or reverse some of the organ damage. Well, I was diagnosed with rheumatoid arthritis back in 2006-2007. And let me just say from personal experience that if you actually have your regular checkups, you take your medication and have a proper follow-up with your doctor, you know what, you can actually live a very normal life like anyone on the street. So there you go.
Much research has been performed in autoimmune disorders in the last 5 to 10 years, which has led to more effective treatments becoming available. And we hope that even more effective treatments will soon become available to help our patients. And in a step towards serving more patients and improving the care of patients with autoimmune disorders, SGH has set up an autoimmunity and rheumatology center. This center synergizes service, education, and research, and will have specialist clinics dedicated to the treatment of specific autoimmune disorders such as scleroderma, systemic lupus erythematosus, rheumatoid arthritis, and spondyloarthritis. Multidisciplinary services such as physiotherapy and occupational therapy are available to patients with autoimmune disorders. And senior nurses trained in rheumatology will be on hand to educate and counsel our patients. Patients with autoimmune disorders do require long-term care and follow-up. It is very important for patients with autoimmune disorders to maintain a positive attitude because effective treatments are available, and it has been clearly shown from research that a positive attitude has a good impact on the outcome of their treatment. Regular checkups with their rheumatologist are also essential to maintain good control of their disorder. Get in touch with other patients who can help you to understand more about your illness and how to cope with it. Build a supportive network of family and friends who can provide assistance. Importantly, there is no need to be frightened, as effective treatments are available for autoimmune disorders, and most, if not all, patients can lead normal and productive lives.
We hope this video has helped you understand more about autoimmune disorders and that patients can actually live on with a more positive mindset. Well, thank you for watching, and goodbye.
Cons. Autoimmune diseases are more frequently in women than in men. It's felt that the stronger of family may influence the immune system to respond some women to autoimmune disease. Furthermore, the presence of the autoimmune disease increases to the change for developing another simultaneous autoimmune disease. Usually applied in Ecuador, there is a high incidence of the hypovitamin D in the Ecuadorian patients who come to the rheumatology center. Thank you.